Hello everyone, I'm Macomb County Executive Mark Hackel. You know, a full year has passed since the very first case we had recorded here in Macomb County of COVID-19, which happened on March 13th, 2020. The state had their first two cases on March 11th, 2020. Simultaneously, Oakland and Wayne County had theirs. But you know, I think everybody recognized this pandemic was going across the globe. And obviously was even here in the United States much sooner than that March 13th date we had. But with that being said, we were kind of preparing ahead of time with our emergency management and the health department to try to figure out what do we need to do, listening to CDC guidelines and kind of paying attention to what some of the experts were saying as to what the impact might be with people in a community. And so with that, we immediately, once we had our first case here, instituted the emergency orders in the state of emergency. And by doing so, we had to figure out, okay, what do we need to do to try to figure out how do we keep people safe in the county? The number one thing was communications, and try to figure out how do we connect with various communities that were relying upon us as a county, but also how do we connect with the state and federal government to make sure that we're listening to some of these guidelines and understanding how to best deal with the situation with best practices. There was a lot of confusion. I think a lot of people were worried. There was a lot of panic. Gosh, if you remember early on, people were going to the grocery stores and taking up all the paper items, if you will, specifically toilet paper. People were worried that there wasn't going to be enough stock in their homes with food, and even concerned about maybe there's going to be a food shortage. So there was the idea of locking people down and making sure that stay at home because it was safer at home, shutting down some of the workplaces, with just the essential workplaces being open. But we looked at ourselves as a county and recognized, we are essential. County government or any government entity is supposed to be there in times of need, not just the normal day-to-day operations or things that are going on. But when there's a crisis, we needed to stay open. And so we did. But we yet knew we had to take care of our employees to try to figure out other remote work sites or locations people can do work at, but yet still be part of the solution as we move forward. And so we were fortunate. We got a tremendous amount of support from the various departments within county government, and specifically all of our countywides, and even the Board of Commissioners, specifically when it came to the funding and the support needed to help us get through this from our emergency management perspective. We leaned heavily on our emergency management to help guide us, as well as our health department. They're the two entities, I think, if you had to look and say, these were the most integral to try to figure out how do we get information to the public, but yet manage through this crisis the best. And one of the first things we had to do is figure out how do we stockpile PPE. There was no PPE. In fact, we turned to some of our manufacturing facilities and found that, this whole idea of, Macomb County being the arsenal of democracy, arsenal of innovation, they turned out to become this arsenal of health, if you will. They were making gowns, they were making masks. In fact, some of them were making even ventilators here that were needed in the healthcare systems. So we realized that people were trying to figure out how do they ramp up because there was no national stockpile, there was no statewide stockpile. No municipality had a stockpile of PPE, and even the right type of PPE, what we're supposed to be wearing as far as gloves and masks and gowns. So we had to reach out and try to figure out how do we become somewhat competitive in maybe procuring some of that. And let's just say to date, we now have a stockpile. But that was one of the first challenges we had. And probably the secondary one was when people started realizing, what are we doing about testing people? Some people were very concerned that they may have had this and they wanted to find a test site or location. So our health department had to reach out, whether it was working with our hospital systems, some of the urgent care facilities, and even some of the pharmacies to figure out is there testing opportunities and how do we get these test kits? So we had to work obviously through the state government and even the federal government to procure some of those test kits. And we come up with multiple locations, and to date, I think that too has subsided as far as, people want to test, they can find a test site somewhere here in Macomb County and probably even anywhere across the country. But contact tracing became a big issue too. When somebody did test positive, how do we reach out to let people know that they may have been in close contact with somebody that had this so that they too can keep themselves safe and avoid contact with others? We started off with our health department of having 6 people that did contact tracing. Well, they ramped up, and to date we have 60 people that still do contact tracing. We had a contact person for each one of those communities or municipalities so we can continue to work with their elected officials as well as their community members to try to give them insight as to what's happening, what we knew, what we could make sense out of what was happening from CDC, state guidelines, and what we were able to provide them as a county. There was a heavy emphasis and a lot of folks leaning on the county for support during that time. So we instituted the MacombGov.org website so people can go to that. We did a tremendous amount of updates on a regular basis to try to keep people informed as best we could about things that we understood and knew what was happening and what may be happening. And so with that, that became, if you will, kind of our contact with the public and with the municipalities. But it was incredible, the amount of attention that was drawn to the county at that time from school districts, businesses that were concerned because they're being shut down. What do we need to do? How do we handle it? How do we keep ourselves safe? So we were trying the best we could to provide all that information and direction at that time. And lo and behold, we were very fortunate. We were given some funding from the federal government through CARES funding, this CARES Act. And here in Macomb County, we got $152 million to go ahead and support our efforts here in Macomb County to take care of, whether it's PPE, testing, making sure we're supporting business, and Macomb Community Action, stepping up and helping people that are part of our vulnerable population, our seniors and people that maybe are in need of supplies and support. So one of the first things we did working with our planning department was we reached out and realized, you know what, there's an opportunity to help support some of the businesses that had been shut down and were struggling throughout this process, making some of the rent payments for some of their employees. There was a tremendous concern that they had. And so with our small businesses here in Macomb County, we dedicated over $80 million, set it aside specifically for small businesses, and providing grants to different businesses around the area, working with the, if you will, treasurer's office, who had to receive that fund. And with that $152 million, we had to call in an auditing firm to work alongside of the treasurer's office and our finance department to make sure we were following the guidelines and regulations that were, I guess, set forth by the federal government, to make sure not only that we're keeping ourselves out of harm's way, but also the businesses that we're providing some of these, if you will, grants to. And so we were able to get that money out, and a lot of emphasis and work with our chamber partners to help make that happen, as well as our planning department, really did help at least get some of these businesses by. And we know some of them are still going through some challenging times, and we're still going to work with them. Not only is that money very helpful for some of the businesses here in Macomb County, there are people that were in tremendous need. And so we had to figure out, how do we reach out to our seniors? The outreach that we had from Macomb Community Action and our senior department was incredible. I mean, they would come up with some very creative ways to try to figure out, how do we support people that were vulnerable, maybe needing of food, needing rent payments, supporting some of the things that they had special needs or specific needs on. And again, the seniors, the Meals on Wheels program. People don't realize the importance of that. There are thousands of people that are on that list that we provide meals to on a daily basis. But at the onset of this crisis, we were concerned about seniors, and a lot of our support for Meals on Wheels came from seniors. They are actually ones that are out there driving these vehicles and supplying these meals to other seniors. But we wanted to keep them out of harm's way. So what we did is we reallocated staff here in Macomb County to do those, if you will, routes. They were driving those meals around to try to take care of that so we can keep our seniors safe. And in the process, well, I'll tell you, our senior department came up with even something that was creative. We were the first ones in the entire country to come up with this, and we used some of those CARES funds to take care of it. But there's a Ship program where people could actually sign up to have food delivered to their homes by ordering it online from some of the outlets that are available to do so. And so we took care of actually their membership fees for an entire year, and we are working on extending that as well. So we signed a lot of seniors up here for the Ship program, so they didn't have to go out to the grocery stores and try to figure out how do they get around the grocery store and concern themselves with being unsafe. So our senior department really stepped up to the plate to work with our senior population here in Macomb County, along with all of our senior outreach organizations that are out there. And when it came to food distribution, I mean, there was a real concern. I mean, they shut down the schools, and people didn't realize, yet there's still a lot of kids, that need that support from the schools when it comes to meals. And so we worked with our ISD partners and our school superintendents to try to figure out, how do we keep that going? And we were able to come up with food distribution locations, some of them at the schools, some of the other locations. And our food bank and our food warehouse, well, I'll tell you what, the support we got from many organizations, companies, and even some of the funds we got with the CARES funding really helped sustain that and support that. So a lot of partnership and trying to make sure that people had the food available during this trying time was as a result of the partnerships we were able to create during that process. And we look at our hospitals. Hospitals early on, remember, people talked about this flattening the curve. They were inundated. I mean, there was a lot of cases that were coming their ways, and that's what hospitals are geared toward. They're there to take care of patients. I know they've been given other responsibilities, even with this vaccination, but they were there trying to figure out how they care for the patients, and the influx of patients coming in with COVID-19 was incredible. And so with that, we were worried about overflow locations, trying to figure out what do we do. So the continued conversation we had to try to figure out how do we get people to realize the serious nature of this and making sure they're following CDC guidelines to flatten that curve, I think proved to be pretty effective. A lot of people were abiding by the CDC guidelines, and even if it wasn't because they were feeling like they were being forced to, they wanted to be part of the solution here in Macomb County, and they did. And so with that, we were able to flatten that curve, took a little bit of pressure off our healthcare systems, and obviously, they're being looked upon as being the heroes in this process here, because they were right there on the front line of dealing with the challenges that COVID presented. And they were seeing some of the challenges, and unfortunately, not only the sick patients, but the ones that died as a result of it too. So that had to be a tremendous challenge for our health departments, not only health departments, but even healthcare system folks throughout the entire state. And credit to them, and our hats off to them for the efforts that they put forth. But with that being said, our schools, boy, I tell you, they faced an incredible challenge to try to figure out how do they provide some type of a learning environment during this process, knowing that it's not going to be in person, and ramp up the deal with some of the remote learning. We are using some of those CARES funds and got those out to the schools to make sure that every kid had some type of a computer or some type of access to the schools. And so we worked with our school superintendents to provide that funding so they can go ahead and purchase the technology necessary to continue education for our children. And again, the efforts put forth, I think, have made a difference. It's probably not the best learning environment, but one I think at the time was probably the safest as we continue to move through this particular crisis. As I mentioned before, county government did not shut down. We try to figure out how do we do things, but do things differently and try to provide a safer environment, not only for our employees, but people that sometimes want to come into a building and access the services we provide. So the remote services that were provided through the clerk's office, whether it was the treasurer's office, and trying to figure out how do we still deal with the tax issues, even the public works, they kept things flowing, and that's what they do. And so they were able to do that. Prosecutor's office, limited number of cases, but still we had to figure out, how do you keep the wheels of justice turning? And the jail with the sheriff. Boy, they were hit hard, much like many congregative care facilities, but trying to make sure that we try to figure out how do we deal with a prisoner population where we don't want to obviously have them infected and or the staff working in those facilities. So everybody did their part. The work still got done. I mean, there were people here in county government that wanted to be part of the solution, and they were all chipping in to be part of the solution, realizing we still have a service to provide. Our roads department, everybody knows about roads. They were still getting plowed even during the winter months and patching up holes, and still now we're working on construction. So all that was still taking place, knowing that we've got this crisis, we got to keep our employees safe, but still provide the best service we can during this challenging time that we're facing. So where are we at today? A lot of what we've been doing is still a continuation. Caring for our seniors, Meals on Wheels, the Ship the program, making sure we're still providing an opportunity for seniors to get food delivered to them. Macomb Community Action, taking care of people that are vulnerable in our communities, making sure our food warehouse is stocked and we're getting food out to folks. We're also making sure that when it comes to this whole idea of dealing with the health department, that we're managing the sites for people to go ahead and get tested. We're following up with this contact tracing. And right now, the big emphasis is trying to figure out how do we deal with the vaccination. In this process, albeit there has been challenges, and good, bad, or indifferent, I think everybody wants to be part of the solution and trying to figure out how do we manage it best. People can get signed up on lists, and there's locations people can go to all around the state and basically all around the country. So for Macomb County, we're no different than everyone else. We encourage people and continue to encourage people to get on every list that they can, if available, making sure they're getting hold of a pharmacy or their healthcare system. And obviously the county, we have vaccinations. But one of the things we're most proud of here in Macomb County, we have been very focused on what we consider is the most vulnerable of the population. In fact, statistics, data, and science all point to the people most vulnerable are those that are 60 years of age and older. In fact, 90% of the deaths are attributed to people that are 60 years of age and older. So we are very laser focused on trying to make sure we get the vaccines to folks in those areas. In fact, proud to say here in Macomb County, we've vaccinated well over 60% of the people that are 65 years of age and older here in Macomb County. That is a tremendous number. In fact, by numbers, 93,000 people have gotten their first dose 65 years of age and older here in Macomb County. It is about 152,000 folks in that category. We're going to continue to do our best to make sure everybody that has access to a vaccine gets a vaccine. We have many locations out there. We're working on partnerships like SMART, our transportation system. Most people don't realize it, but Macomb County has a fully connected transportation system. Every community in Macomb County is connected to SMART, and thankfully so. Why do I say that? Not only throughout the crisis did people still need transportation, getting to and from, but they stepped up in a big way here in Macomb County. When we reached out to them and told them, you know what, we have some vulnerable population, we have some seniors, we want to give drive-through opportunities for people to get vaccinated, they raised their hand and says, we will do a list and we will take care of seniors here in Macomb County. How so? People were able to go ahead and call the SMART system or log on to it, get themselves an appointment, and get scheduled to go ahead and get driven out to one of our sites out in Richmond, Lennox. And again, the folks out in Richmond, Lennox EMS did an incredible job of stepping up as well with SMART to combine for an opportunity for people to get vaccinated, specifically in the age category of 60 and older. We partnered with other communities around the county, got some agreements with Sterling Heights to make sure that we are trying to figure out how do we give access outside of just one location in Macomb County for people to get vaccinated based upon the allotment that we get from the state of Michigan. And so many more opportunities are out there. I myself had asked for 50,000 doses a week from not only the state, but even reached out to the President of the United States saying we can deliver 50,000 doses a week with just our operations here in Macomb County if we get that. Knowing we're getting far less than that, we're still able to do the best we can with the doses that we get, and we'll continue to do that on behalf of the public. But make no mistake about it, our health department here in Macomb County is top notch. They have done an incredible job of trying to make sure that they're getting out there. And anyone who's been through those processes, who's been fortunate enough to go ahead and get a vaccination, whether it's Richmond, Lennox, whether it's Sterling Heights, or the system we have at our Verkulen Center here in Macomb County, I'll tell you, people have said nothing but good things and good praises for the work done by those healthcare professionals administering those doses. So we're fortunate here in Macomb County. We know we can handle more, we want to handle more, but until we see that, increase in supply, we're going to continue to deal with this demand that's out there to try to figure out how do we satisfy it as best we can. So when people ask me, what is the most important aspect and way of handling this particular crisis? No different than back in my days in law enforcement, 30 years of being a cop and then now 10 years of being a county executive, communications is key. And unfortunately, sometimes you get good information, but then sometimes there's bad information. And in today's day and age with social media, there's a lot of mixed information, and sometimes it's politicized, by the other public personalities or people. But here in Macomb County, we kept that to a minimum. We try to figure out how do we get people the right information, the best information, so we can make the best decisions. And working alongside of all of our countywide elected officials, all of our department heads, leaders, employees, and even the community outreach we had with our schools and our hospital systems, and just the general public, we got a tremendous response of trying to figure out how do we continue to do the right thing on behalf of the people. And for that, I couldn't be more thankful. Because when you're in a position of trying to lead a crisis and work with people, you got to rely upon a lot of people that want to be part of the solution. And fortunately here in Macomb County, we have just that. And so on that note, a lot has happened over this past year. There's been a lot of action on behalf of the county during that process. We're going to continue to provide you the best service possible. But we still need the support of the public in doing so. So I want to continue to remind you to keep you and your family safe.